Person-centred therapy!
Person-centred therapy uses a non-authoritative approach that allows clients to take more of a lead in discussions so that in the process they will discover their own solutions. The therapist acts as a compassionate facilitator, listening without judgment and acknowledging the client's experience without moving the conversation in another direction.
The therapist is there to encourage and support the client and to guide the therapeutic process without interrupting or interfering with the client's process of self-discovery. Person-centred therapy is but one of many types of talking therapy under the umbrella term humanistic.
However, Means and Thorne state the governing feature of person-centred therapy is not its humanistic orientation, but its forsaken of mystique and other powerful behaviours of therapists. In this regard, many humanistic therapies are as different from PCT as psychoanalysis.
Created in the 1950s by American psychologist Carl Rogers, who became disillusioned with Freud's psychoanalytical approach and strongly disliked the fact that the emphasis was on testing rather than treatment, and believed a more facilitative approach would work better. He was also strongly influenced by Abraham Maslow and Otto Rank.
Anyone would be better off gaining more self-confidence, a stronger sense of identity and the ability to build healthy interpersonal relationships and to trust his or her own decisions could benefit from person-centred therapy.
This approach, alone or in combinations with other types of therapy, can also be helpful for those who suffer from grief, depression, anxiety, stress, abuse or other mental health conditions.
Person-centred therapists work with both individuals and groups. Since the client must do a lot of the work in person-centred therapy, those who are more motivated are likely to be more successful.
Person-centred therapy is talk therapy, wherein the client does most of the talking. Your therapist will not judge or try to interpret what you say, but may restate your words in an attempt to fully understand your thoughts and feelings. When you hear your own words repeated back to you, you may then wish to self-edit and clarify your meaning.
This may happen several times until you decide that you have expressed exactly what you are thinking and how you feel. There may be moments of silence to allow your thoughts to sink in. This client-focused process facilitates your self-discovery, self-acceptance, and provides a means towards healing and positive growth.
Person-centred therapy, also known as Rogerian therapy, originated in the work of the American psychologist Carl Rogers, who believed that everyone is different and therefore everyone's view of his or her own world and ability to manage it should be trusted. Rogers believed that all of us have the power to find the best solutions for ourselves and make appropriate changes in our lives.
Person-centred therapy was a movement away from a therapist's traditional role as an expert and a leader, towards a process that allows clients to use their own understanding of their experience as a platform for healing. The success of person-centred therapy relies on 3 conditions.
Number 1, unconditional positive regard, which means therapists must be empathetic and non-judgmental to convey their feelings of understanding, trust and confidence that encourages their clients to make their own decisions and choices.
Number 2, empathic understanding, which means therapists completely understand and accept their clients' thoughts and feelings.
Number 3, congruence, which means therapists carry no air of authority or professional superiority, but instead present a true and accessible self that clients can see is honest and transparent.
Licensed mental health professionals from a variety of disciplines who have training and experience in the Rogerian approach can use person-centred interventions in therapy.
In addition to finding someone with the educational background and relevant experience, you need to look for a therapist or counsellor who is especially empathetic and with whom you feel comfortable discussing personal issues.